Welcome the rising nurses. Today we are going to talking about anxiolytic drug-based important questions for all nursing exams include DHA, Dubai Health Authority, Kuwait Prometric, Saudi Prometric, Qatar Prometric, all global exams b- main for NCLEX based questions. First questions: a patient on lorazepam for acute anxiety becomes very drowsy with respiratory rate 8 breaths per minute. The priority action: start IV fluids, support airway and prepare flumazenil, give naloxone, place in Trundleberg. Correct answer is B. Support airway and prepare flumazenil because respiratory rate is 8. Bradypnea. Benzodiazepine overdose, respiratory depression, airway. Flumazenil is the antidote of the benzodiazepines. Next questions. Teaching about buspirone should include works within 30 minutes, causes strong sedation, takes 2 to 4 weeks for effect, risk of dependence in high risk. Can you look the question? Buspirone effect 2 to 4 weeks. Correct answer is C. Buspirone has delayed onset, non-sedating, minimal dependence. Next question. Which finding needs immediate report in a client withdrawing from high-dose diazepam? Tremors, seizure activity, anxiety, insomnia. Diazepam for seizure activity. Benzodiazepam withdrawal seizures are life-threatening. Next question. Best time to give temazepam, a benzo hypnotic for insomnia. Morning, at bedtime, with lunch, 3 hours after dinner. Always giving the bedtime for temazepam. Hypnotic benzos are given immediately before sleep. Which statement by a client on Alprox needs correction? I will avoid alcohol. I won't drive until I know how I feel. I will stop taking it when I feel better. I will rise slowly to prevent dizziness. Correct answer is do not stop abruptly, taper to avoid withdrawal. So looking questions looking correct answer is I will stop talking it when I feel better. Next question. Barbitrate toxicity risk is increased because short off of time, narrow therapeutic index, long off of time, life, antidote available, renal excretion only. Correct answer is barbitrates have narrow safety margin and long off of life. Next question. Contraindication or caution for benzodiazepine. Hypertension, sleep apnea or severe COPD, hypothyroidism, iron deficiency anemia. Looking the question, benzodiazepine is a respiratory related drugs. Sleep apnea or severe COPD is correct answer. If you have sleep apnea or COPD, don't give the benzodiazepine. Benzodiazepines, respiratory depressants, CNS can worsen hypoventilation. Next question. Nursing action for a new clonazepam prescription in an older adult. Encourage daytime naps, implement fall precaution, extra fluid, high protein diet. Correct answer is benzo. Benzo is sedation, ataxia, risk of fall. Correct answer is implement fall precautions. Next question. Teaching to reduce paradoxical agitation risk with benzos. Take double dose if anxious. use lowest effect dose, avoid alcohol stimulants, take with grapefruit juice, crush extended release tablets. Correct answer is use lowest effect dose, avoid alcohol stimulants. High doses substance can worsen agitation, especially elderly. Next questions: which interaction is most concerning with diazepam? Acetaminophen, folic acid, alcohol or opioid, calcium. Additive CNS respiratory depression. Correct answer is alcohol or opioids. Next question: expected adverse effect of midazolam you during a procedure. Hypertension, antrograde amnesia, meiosis, diarrhea. Correct answer is antrograde amnesia. Maybe short acting benzos, pre-procedure amnesia. Next question: buspirone key safety advantage. Anticonvulsant, no respiratory depression, sedation, quick onset, potent muscle relaxant. Key safety of buspirone in non-sedating, good for long term. No respiratory depression, sedation is correct answer. Next question: client on buspirone ask about grapefruit juice. Safe in moderation, increase elimination, avoid can increase drug levels only at night time. Correct answer is buspirone. When you taking buspirone, don't take the avoid the grapefruit. Why? Increasing drug levels. Grapefruit juice inhibits metabolism. CYP3A4. Correct answer is antidote for barbiturate overdose. Barbiturate overdose is flumazenil is correct answer is not. Correct answer is no specific antidote, supportive care. Benzodiazepines only have flumazenil antidote. A patient uses Alprox PRN daily for months. The nurse anticipates no issue in stopping. Physiological dependence, taper slowly, add H2 blockers, switch to solpidem abruptly. According to physiological dependence, taper slowly. Long-term benzo uses dependence. Next question: priority. Lab assessment for phenobarbital therapy. Thyroid panel, respiratory rate and sedation level, glucose, blood glucose, urine analysis. Always using phenobarbital is barbital drugs. Respiratory rate and sedation level we should monitor. Barbiturate cause respiratory and CNS depression. Which patient is best for buspirone? Status epilepticus, severe alcohol withdrawal, generalized anxiety disorder for long-term pre-procedure sedation. Buspirone is a long-term drugs. Generalized anxiety disorder long-term. This is correct answer. Next question. New diazepam IV push. What rate? Rapid IV push, slow IV push to avoid hypotension, respiratory depression. IM injection preferred with dextrose only. Correct answer is slow IV push to hypotension. Give slowly with monitoring. Maybe respiratory depression may occur. Next question: yearly signs of benzodiazepine toxicity to monitor polyuria, ataxia and slurred speech, hypertension, mydriasis. Correct answer is B. Ataxia and slurred speech. CNS depression signs appears first. Next question: discharge teaching best statement. I can drink a little alcohol. I will avoid driving until I know the effects. I will double if I am very anxious. I will stop when I feel better. Correct answer is I will avoid driving until I know the effects. This is all our important questions for the anxiolytic drug based important question. These questions cover all global exams. Don't forget, remember, benzodiazepines works fast but carry dependence risk. Barbiturates have higher toxicity and buspirone is safe but slow acting. Always think ABC analysis. Airway, breathing, circulation. First in emergency. Thank you for watching the. Don't forget to like, share and subscribe for more pharmacological made simple.